Dr. Abayomi Ajayi is the Chief Executive Officer of Nordica Fertility Center, Lagos. With a remarkable 30-year career in medicine, Dr. Ajayi has dedicated his life to saving lives and changing destinies, a passion he has carried since childhood. He not only pioneered various assisted reproduction services across Nigeria, particularly specializing in vitro fertilization IVF and infertility treatment, but also broke barriers by bringing advanced medical technologies like HIFU to Lagos, making it the only facility in Nigeria with this technology. Thank you so much, Dr. Ajayi, for joining us on the program. It's always a pleasure to have you talk about reproductive health. Now, it will be right for us to say that you're one of the pioneers of assisted reproductive services in Nigeria. How's the journey been?
Well, thank you for inviting me to start with, and it's a great thing that you considered me worthy to be on this program, because like you said, it's for trailblazers. The journey has been topsy-turvy, if I'll say. There's some heights, there's some lows, but on the average, it's been great. So many things. You know, when I started and I brought my equipments to Nigeria for the first time, and the guys, the custom guys saw it, and they said they labeled it metallic furniture. And that supposed attracts a particular tariff instead of medical equipments. So we started from there. A lot of going back and forth. But that was 21 years, 22 years ago now. But of course, there are newer devils now in Nigeria. Power being one of the greatest of them, exchange rate being another one. So, but we thank God everything has panned out well.
Well, I'm going to ask you, I always wonder, in the medical field, why the reproductive health part that you took?
Okay, it's another story. I mean, I always wanted to be a gynecologist. I don't know why. I think what happened was when we were introduced to all the subjects in medical school, O&G was the one that appealed to me the most.
Awesome.
So it was not difficult for me to choose that. But even when I was training to become a gynecologist, I think I always have this thing for people who have the short end of the string in life. And I saw something with people who have infertility. Sometimes they've achieved everything in life, but the fact that they can't have children, people tend to look down on them. They tend to look down on themselves.
Is that not a societal thing?
It is, but it's become sort of acceptable, even to the people themselves, you know. Sometimes you talk to somebody and she says, is it because I don't have children? You understand what I mean? And that for me was, when I was training to become a gynecologist in the University College Hospital, Ibadan, there used to be a professor of urology, of blessed memory now, who used to have this very notorious meeting on a Thursday. And you'll see made men, come to his clinic. And then the summary is that, sorry, there's nothing we can do for you. Go and pray. And I started thinking to myself, there must be something that can be done somewhere in the world.
Scientifically.
Exactly. And so that was how I came across IVF. But it was in the budding stage, and people thought it was even impossible to do it in this part of the world. Nobody was thinking of doing it.
How successful has that been in the last 22 years?
I think it's been. You know, what I tell people now is that Nigeria, I can tell you for free that you can have almost anything that is available anywhere in the world. Now you can have in some clinics in Nigeria. Not every, but in some clinics in Nigeria.
Okay. Well, that's going to bring me to the latest, the new baby. Okay. And that is the HIFU. You are the only one that has that HIFU machine in Nigeria, right or wrong?
Right. West Africa.
Tell us, in West Africa. Awesome. Tell us about that. What is HIFU?
Well, HIFU is high intensity focused ultrasound. And like I say, I mean, there are things that I have guiding principles in life. And one of them is that I always want to cater for those people who they seem to have the short end of the stick.
Uh-huh.
And as a young doctor, I witnessed or heard about a very popular lady that died from having fibroid surgery. Okay, and that made me to start thinking. And I became a gynecologist. I saw how bloody the surgery happens to be. And so I knew something that sometimes it's not the doctor's faults that makes patients to die. But sometimes we don't have enough equipment. Sometimes even in the best places where they have the best equipment, patients still die. Okay. And so I started thinking of how can we treat fibroids without surgery? Okay. And remove all these risks that are inherent in surgery. Because sometimes it's anesthesia that kills some of these people that die.
Really?
Yeah, it's not the surgery. It's because of anesthesia. So I was looking for a way that can eliminate all those things that are responsible for death. Because we know that fibroids are commonplace, especially in Africans. About 70 to 80% of our women will have fibroid of different sizes before they are 50. So this is a problem that is really our problem. And so if we can look for a way to solve it without surgery, then I think we'll have done something for our women. And so that was what fueled my journey. And I was on this journey for about 8 to 10 years, following the inventions that were non-surgical. Until I got to 2020, when I saw that, okay, there's a method that we can use in Nigeria, that it's patient-friendly enough and effective enough that we can use in Nigeria. So that was when the journey started to get this into Nigeria. And in July 2021, we brought it in. We've done over 430 cases now. Wonderful results. The only problem we still have is that people think they're comparing it to surgery, that you have removed the fibroid. We have not removed the fibroid. What we have done, we have killed the fibroid. So it starts shrinking in size. So it depends on how big the fibroid was before you started. You know, what we say is in about 3 months, it will have shrunken by about 30%, in 6 months, about 50%, in 1 year, about 70%, okay? All right. So imagine if you started with a fibroid that is 15 cm in diameter. So even after 1 year, if you have 30% left, that means you still have about 5 cm left. But the good thing is that the symptoms go away almost immediately. So if you are bleeding heavily, then the bleeding, by the second cycle, your bleeding becomes normal. Okay. So if you are having pain because of the fibroid, but what we also tell patients is that, you know, here in Nigeria, especially in Africa, we've associated or we think fibroids cause infertility. So we interchange the two.
But it does, doesn't it?
No, it's associated with it. It does not cause infertility. It's only about 2 to 3% of infertility that fibroids cause. And that is because the fibroid is sitting in a place where the baby should be, or in a place where the embryo passes into the uterus. So it's just 2 to 3%. Most other cases of infertility, they still have other issues. For example, it might be the man that is firing blanks. In fact, you know, in this environment now, men probably are responsible for infertility more than women. So,
and that is something that we don't like to really talk about, this part of the world.
yes, but you know, yeah, that was a few years ago, but it's becoming more acceptable now, or more believable now. Exactly. Actually,
Yes.
yeah. So, and you see, I've seen a doctor, I mean, a patient holding on to a doctor's collar before just because the doctor said you don't have sperm count. But that was many years ago. That doesn't happen anymore now. Men have come to see that, okay, fine, it's part of life.
It's part of life.
We are now even seeing men coming to fertility clinics to make inquiry. So the things are changing, but it's mainly due to education. And that's why I believe that the first thing as doctors that we need to do is to educate our people. Even when you have the services, they need to be educated on what do they need to expect. For example, this HIFU thing. Now, because we're still the only ones doing it, you know, I say sometimes that sometimes it's not because of malice. It's sometimes because of ignorance. Because they go to some doctors and the doctor says, oh, the fibroid is still here. Yeah, we know the fibroid is there, but it's shrinking over time. So if you can follow it up, you will see that it's reducing in size.
At least something is being done to help our women.
Yeah.
Tell us something. You know, with all of this, there is so much to keep abreast of. How have you been able to keep, you know, abreast of all the developments in the reproductive health, particularly IVF and all of that, and assisted conception? Let's leave it at that. And more so with, you're the founder of endometriosis. Am I correct?
Yes, support group.
Support group.
Yeah.
You are the founder of this, you're the founder of that. You know, have you been able to keep above all these developments? And in which way? Let me just make that a two-pronged question. Also, how have you been able to become a mentor for so many, if at all?
Yeah.
I'd like to know that, because you can't have this wealth of experience and then keep it to yourself. So you must be giving it back to those coming behind you. I'd like you to answer that as well.
Actually, you've answered the question, because the second question is the one that answers the first. Okay.
Let's make it into one.
Okay, fantastic. If you want to be able to do a lot, you have to train people.
Absolutely.
You have to mentor people.
Yes.
I think that's what I've been blessed with. Fantastic people.
Wow.
Okay. And I understand that I don't have more. I mean, I don't have more than 2 hands. Okay. All right. So if I need 20 hands, I have to train 9 other people. And that's why people ask me, how come you have a clinic in Asaba? How come you have a clinic in Abuja and you stay in Lagos? Yeah, that's it. Because I've trained other people, I've multiplied myself.
And they can keep
and they
the
can
place
do
running.
exactly. Now, but now because I realized that also, I've made mentoring structured.
Okay.
So I also mentor young doctors who don't even work with me at all. So in a structured manner. Okay. So we have the physician mentoring group where we formally mentor doctors, young doctors. Because I've seen that why many of the doctors are leaving Nigeria is because they don't know what to do with themselves. There are a lot of opportunities in Nigeria. But as a young man, when you force in any field, everything becomes so muffled and disorganized to you, and all you're just seeing are just the problems. So you need somebody to handhold you and say, no, you know what? This is how all of us saw it initially. But if you can just stay on, you will now find the path, especially if you can follow somebody who has found the path. It does not have to be direct. The person can just be somebody that gives you time. Now, in my mentoring group, I have mentors. They are not all doctors, from different spheres of life. But one thing they've done is that they are accomplished in whatever they are doing. So I have lawyers, I have academics, I have engineers who are mentoring doctors. Because life, the more we grow in life, we see that to be successful is the same thing all across. Whether you're a doctor, you're a lawyer, success is the same thing. It's how much you can develop your mind. Whether you're a doctor, you're a lawyer, you're an engineer, just means...
You're a broadcaster.
Or you're a broadcaster. Just means that is what you have spent your time in specializing on. So, and that's where what I'm trying to let these guys see, that look, it's not only doctors that can mentor you. And they are beginning to see that now, that actually, if I were young, I would prefer to be mentored by a non-doctor who can think beyond the problem doctors have is that we only think of probably at best 2 people. If you are a gynecologist, the woman that is pregnant and the baby that she has inside. And life is more than those 2 people.
How do you envision assisted reproductive services in Nigeria? And are there any developments that you would like to see in the future?
Well, the good thing about assisted reproduction is that it's not a localized business, it's a global business. And so some people are setting the standards for you, whether you like it or not. Okay.
Since it's global.
Since it's global. So we know we are poor on research in this part of the world. Yeah. Okay, so some people are doing the research. It's not because we don't have the people who can do research, it's because we don't have the money. The least funded of everything is always research. Okay, we have
in any organization as well.
It's everywhere, and it's but fine. Okay, it's level of development, but also don't close your eyes to what the other part of the world they are now doing. People who have dedicated a lot of money to research, and do not be proud not to go and see what they're doing. And then if I travel abroad, that's what I tell people. I just don't go and travel and then you find me only going on shopping.
You just don't go and flange.
No, there must be something that you are adding to yourself. You must go and see what are they doing now, what are they doing differently, and so that will make a difference also in what we are doing in Nigeria. So for me, I see the future of assisted reproduction in Nigeria to be very bright. One thing that I always say is that Nigerians, not only doctors, we're very smart people. We're extremely smart. Unfortunately, we have not been able to get it right at a particular level. But the individuals are smart. The doctors are very smart. The engineers are very smart. Okay. What we need is for us to be able to tie this together. And I mean, look at it, go to the UK, go to the US. Top doctors are Nigerians. So you ask yourself, what is wrong with us at home? Okay. So that's why I said, for me, I've seen Nigeria and Nigerians doing very well in the field of assisted reproduction over time. And, one of the things that we have not also learned in Nigeria is to give honor to whom it is due. Because that is how you can collaborate. If I know you are very good in this, then I should be able to say, okay, Siju, why don't you let us do this? And you do this, and I do this. I put you in your area of strength, and I stay probably in my area of strength. And if I don't have any, I learn from you. It doesn't take anything away from me. I mean, you don't lose anything by lighting another candle, So we need to also get to see that, But I think that's one thing people say is the poverty that is driving that. But I say poverty sometimes is not in your pocket. It's in your brain. I mean, because we know so many people have so much money and they still think like poor people, you know. So, but I'm not, I mean, that doesn't bother me so much because I know it's a phase. If the whole country develops, then some of those things will disappear, you know. So I think it's not only in assisted reproduction. In every facet of life, I think we're going to become better. And that's why I say to these people who are going abroad, you know, Nigerians now, the mindset is once we go abroad, lie, I will never come back. People don't do that if they want. You see, you need to, there is no other country in the world that is yours. Whether you go and get green pali, go and get red pali, that's your business.
And black one.
Once when the chips are really down, they're going to ask you, where are you from? Because whether you like it or not, you carry an identity that you cannot hide.
Absolutely.
So people
Probably Nigeria.
Yeah. People are going to ask you, where are you from? And that will preclude you from some things. I have a cousin who, during the, Y2K compliance, he was into IT, and then the mayor of his town must see him every morning. You know, in America, they thought everything was going to collapse with this Y2K thing. And so the IT people were just the cream, the la cream. So the mayor will see him, they will have a meeting of, and, but fast forward, 24 years after that now. Nobody knows where he is.
The story is different.
Nobody knows where he is. And I was telling them, I said, come, this is the point to come to Nigeria. Get that mayor to write a letter for you to come to Nigeria. You get a wonderful job. And your life will never remain the same again. But, of course, it didn't.
As a trailblazer in reproductive health, and with bias for assisted conception services, are there misconceptions about assisted reproductive health? Because, always, once we are Nigerian, African, we already have our own ideas and ideologies concerning different things.
Of course.
What are the misconceptions that you've seen, in the so many years that you've been doing this? And is there a way that we can rise above that?
Well, since you said misconception, the best way to rise above them is always education. Educate them more. Look, there was a time in Nigeria that we thought if you don't have a big belly, you don't have money.
You're not rich.
Yes. But we know better now that really what big belly will do to you is hypertension and diabetes. How did we know that? How did we change that mind frame? Okay, education. So for me, I think that's still what is going. Why is it changing now that men are coming up to say, look, I have issues with reproduction? Education. So what are some of these misconceptions? Up to now, some people still believe that babies born from IVF are not normal babies.
I heard that before.
Omonugo.
Yes, I heard that before. It's always nice to talk to people that have been there and are doing great stuff in the field of endeavor. And I'm going to take something away as we actually call it a day here on this show. You said something, and that's where I want us to leave it for today. It doesn't take anything if you light another candle. That I hope my viewers are going to take that away as well and really think about it. What does it take for you to help the next person get there? Dr. Ajayi, it's been a wonderful time with you. It's been a pleasure. I always love talking to you, and I just want to thank you so much for coming on the show today. Think
Pleasure is always mine.
Nigeria.
Think Nigeria, yeah.